Hi, Dr. Tom Rocchio. I work at PA Foot and Ankle Associates, where I'm a senior partner. The types of pathology that I treat in the foot and ankle are pretty broad in range. We deal with basic injuries and things that can go wrong from the foot and ankle, from an ingrown toenail to questions that you could have on a suspicious skin lesion of your lower extremity. But it extends much greater than that, and you're going to see that highlighted in a case presentation today. In the case today with Natasha, there is a particular excitement when I help present this case because it marries two of the departments I swim between, with external fixation, which is a circular device many times, or a three-dimensional device that sits outside the extremity that is utilized to manipulate bony structures and stabilize soft tissue structures, with some of the most current orthopedic foot and ankle reconstruction products and techniques that are available.
I'm Natasha Rutherford. I've been riding horses my whole life. I went to Del Valle University for equine training, and I have my own barn that I built last year. I have 15 horses. It's my full-time job. I teach riding lessons. Last year in May 2017, I broke my ankle and my repair sort of failed. So Dr. Rocchio is trying to fix me up so I can walk again. I was getting on my horse and I didn't even have my other foot in the stirrup, and he started bucking, and I landed on my feet, unfortunately, and broke my ankle pretty badly.
She was referred from another foot and ankle surgeon for solutions that were outside the box. She had been referred to previous doctors for very appropriate surgeries for solutions to her foot and ankle traumatic injury.
I was actually at the barn by myself, and I had to drag myself to get to my phone. I actually tried to walk and it just kind of collapsed under me. And I knew I was gonna need surgery. I could feel all the pieces, hoping that, I guess I never really thought about not being able to walk comfortably.
What her main concern was that she'd never be able to, what I thought at first was figuratively get back on the horse. She actually meant literally get back on a horse and start riding again, which was her passion.
I was just thinking about the recovery, and then when it started to get worse, it started to deteriorate, and it's hard to not be able to ride myself and do what I love.
What I was able to start to offer for her was an option that would potentially have her regenerate her own cartilage. But there are products now, and there are technologies in medicine that are available that are always changing. What Natasha was open for was a mixture of a semi-aggressive approach to clean up the arthritis that was in her ankle joint, apply a device that looks like a bird cage sitting around her foot and ankle that would allow her to distract around the ankle joint, but still allow her a range of motion of her ankle with the distraction. So we were able to clean up the arthritis. We were able to have her soft tissue and muscles still function, so she didn't have issues in the future with weakness, which had already started with her traumatic event, and also begin the healing process beyond, which was the thing that was the most difficult, and that was the traumatized cartilage in her ankle joint.
He's very friendly, explains to me everything that's happening, and kind of tells me honestly, but at the same time is positive. My situation isn't great, and it's not really something that is done often, so we don't really know how it's gonna work out, but hopefully what he's doing, but he's definitely honest in that, and explaining that it's not 100% gonna fix everything, but hopefully. The staff has been great. I mean, they do their best to bandage me up and make sure I'm comfortable, and yeah, so everything's been great. I'm anxious to have the fixator removed, and hope that it's going well afterwards, and then I can walk and drive. It'd be nice to drive.
What I hope for Natasha is that we have the ability to have a functioning lower extremity to do the routine things in life, but also some of her a little bit more extreme things such as horse riding. I think that for her, she may have a benefit that is tremendous and is everything that we had previously mentioned, or she may fall somewhere where she gets 5 to 10 years of return of use, and then we need to perform one of those more aggressive total ankle joint replacement options or ankle fusion options. And what my biggest fears are is this patient will slowly or more rapidly begin to fall back into an arthritic degeneration.